Welcome back. Viewers, today is day one of a partial relaxation that we're looking at in many parts of the country. Yes, of course, right now still it's in the prelim stages where many of the states are still figuring out just how they want it implemented, where they want some kind of relaxation to come and how will this actually take place. Some states though have decided to play it completely safe. So states like Punjab and Delhi and Telangana have decided to continue with the lockdown. In fact, Telangana has said they're going to have the lockdown till 7th of May. But then there are other states like Kerala, like Maharashtra, who have decided that they will start bringing in partial relaxation. So now let's look at what the situation is. While we bring in this partial relaxation, cases in our country are still spiking, are still peaking. Right now, we have over 17,000 cases in our country. The death rate is about 3.16% and the recovery rate is about 16.09%. This is as of 20th April evening 5:30 p.m. But I want to just tell you and take you through just how this data looked in the last few days. As of 15th April, viewers, 5 days ago, we had less than 12,000 cases. And then as of Sunday morning, we had 15,000 cases. Since then, by Sunday night, it had become 16,116 cases. And now it's gone up even more. On a daily basis, between 1,000 and 2,000 cases are being added. And hence, that's the question. This is the concern. At this given point of time, when we have more and more cases emerging, should we be looking at some kind of dilution? At a given point of time, when we are being told 80% of the cases that we found were asymptomatic, were not showing any symptoms, should we be bringing in any kind of relaxation? Should we be putting down our guard, letting our guard down and saying, okay, let's allow some kind of movement? Is that the prudent way to go forward? Now, while this is happening, I want to also highlight one specific case. This is the case of the Kerala government. Kerala government that has managed to tackle the coronavirus crisis quite effectively and significantly bring down the number of cases, had a plan of a widespread relaxation, including allowing movement of people, including allowing some supermarkets and salons and everything to open, to allow restaurants to actually open. But then today, the center wrote a letter and the center said that some of these relaxations are against the rules of a nationwide lockdown and central guidelines, and we are extremely concerned that you might be going a step too far. And so the Kerala government right now, we are given to understand, has done a partial rollback on those relaxations. So barber shops will be closed. Barbers can actually come to your house and give you a haircut if you want. Hotels won't be open, but online delivery for food will be allowed. It again begs us to ask this question: just because the numbers are looking good right now, can governments really bring in some kind of relaxation? Let's say good evening to the panelists who are joining us. Raghav, Chadha, spokesperson for the Aam Aadmi Party. I've also got Dr. Sudarshan Ballal, chairman for Manipal Hospitals, joining us this evening. He is also a member of the COVID-19 task force in Karnataka. Dr. Subhash Salunke, senior advisor with the Public Health Foundation of India and a member of the COVID task force, also with us this evening. Good evening to all of you. We'll also have Binoy Viswa, member of parliament for the Rajya Sabha and a CPI member, joining us shortly. And we'll also have Sudesh Sharma of the BJP with us shortly. But let me actually first go across to Dr. Sudarshan Ballal and ask him this question. Dr. Ballal, 80% of the cases were asymptomatic so far. We're still seeing, about roughly 1,000 to 2,000 cases being added every day. Are we moving too quickly in terms of bringing in relaxations?
I think the government has done the right things. The relaxation would depend on the region where you see the doubling time and also the new cases that come on. I think because of the lockdown, India has been very fortunate that the number of cases we have seen as compared to the US and Europe is far, far less. We have about 17,000 infections and less than 500 or 600 deaths, which for a country of 1.35 billion is very remarkable. We cannot keep the lockdown forever, but I think the lockdown should be removed in a phased manner and should be removed in areas where there are very few new cases and the doubling time, like what's happening in Kerala, is very long. So I think that's a decision that has to be taken based on how many cases come as positive, how many patients are sick, and what is the doubling time of the number of infections.
Okay, let me ask Raghav this question because
Hello.
our government in Delhi has decided that now is not the time to bring in any kind of relaxation. Raghav, basis what has this decision been taken? Obviously, not all the districts fully are hotspots. There may be some hotspots in all of these districts. What is the, what are the various factors you considered before coming to this decision?
Well, look, first of all, Delhi is unique in the sense that while only 2% of the country's population lives in Delhi, we have seen more than 12% of the country's total cases of COVID-19 in Delhi. And it's largely because the epicenter of the Tablighi Jamaat Markaz event was Delhi, and we have the Indira Gandhi International Airport in Delhi, where every where international traveler passes through that, visits Delhi, and this is a disease which was essentially brought into our country through some people who had indulged in foreign travel. Now, because of these two reasons, the number of cases in Delhi have spiked. And as the chief minister in his press conference yesterday pointed out, that we may have perhaps entered the stage of community transmission. On a couple of days ago, we tested 736 people, out of which 186 were tested positive. That is a whopping 25% of the overall population that was tested. And all these 186 were asymptomatic. That is a bigger worry, because they didn't know that they were suffering from this. They didn't have any symptom, and they were essentially carriers of this virus. So, we have reasons to believe that in Delhi, whether it's community transmission or a dangerous phase of this disease, we may be knocking on his door, and therefore it is important that there is a complete lockdown until we are able to tackle with this and ramp up our infrastructure ability, so on and so forth. The government has drawn an extensive, comprehensive plan of of having X number of ICU beds, ventilators, PPEs, N95 masks, so on and so forth. And the entire paraphernalia is being prepared, has been prepared. But just imagine if the lockdown would not have been in place, if the lockdown would not have kicked in the towards the end of March, it would have really led to some catastrophic developments in the city. And therefore, it is important that until the curve flattens, until the chain is broken, the stringent measures do stay in place, because it is only for the betterment and the health of the people of Delhi.
No, I completely agree with you. In fact, far from questioning the benefits of the lockdown that we've had so far, I am in fact of the view that in some cases we may be moving too quickly in terms of bringing in relaxation. But Raghav, very quickly, just a clarification on the data that Mr. Kejriwal also gave yesterday. These 186 cases that emerged in one single day, and which were asymptomatic, were these contacts of existing cases, or were this part of a random sampling? How were these, on what basis were these people tested?
Government has adopted a number of strategies. Of course, there are people who feel that they may not have symptoms, but they have been exposed a lot, and therefore they come to the hospitals and get tested. A number of people do approach private setups to conduct these tests. A number of people who came in contact with a person who tested positive, for example, the pizza delivery boy that we usually have been talking about for the last few days, who was detected positive. He came in contact with a lot of people. A volunteer of ours who was selflessly working in the one of the food distribution centers set up by the government of Delhi and giving food to the people of the needy. has also tested positive, and he came in contact with a lot of people, and some of those people were tested. So, a complete contact tracing mechanism has been put in place by the government of Delhi, whereby we also reach out to, the people who must be tested simply because they came in contact with somebody who was a coronavirus carrier. So a mixture of this is usually applied, and on a given day, the government does test a significant number of people, because we at the government of Delhi believe that testing perhaps is the only way to handle and deal with a disease as dangerous, an epidemic as dangerous as the coronavirus.
Okay, let me also bring in, Mr. Binoy Viswam, Member of Parliament for the Rajya Sabha, also member of the CPI, because unlike what we are seeing in Delhi or Punjab or even in Tamil Nadu, the decision has been very, very different for the state of Kerala. Now, Mr. Viswam, basis what have we decided to bring in so many relaxations when we are still, discovering the fact that there are many patients out there infected but silent spreaders with no symptoms?
Don't say that it is so much relaxation. We are very, very cautious. On every step, Kerala was cautious and is cautious, will be cautious. With all precautions, we are moving. We are not at all complacent. We are sure that we have achieved an extent, but not everywhere, not everything. We know that the fight still continues. The fight still continues. And in that fight, the whole state is one. The government, the people, the health machinery, and I can tell you the whole population of Kerala is fighting this menace with one single mind. That's why Kerala could achieve a success to an extent. I would say only to an extent, not everything. There was a time, for example, on 14th of April, we were the number one. 4th of April, we were the number one in the country in the number of the corona affected people. That was 1,71,385 was the number on that day. On that day. But now we stand at the lowest level. At the lowest level. This is the state in the whole country that a very visible achievement could be made. And that achievement was not a miracle, not a magic. It was a conscious effort, an effort put in by a whole people with their glorious past and their very, very committed presence and their vision for the future. Our Chief Minister today also, he repeatedly told to the people that this is not a one man's victory. It is a victory of the people. And that people are still very cautious. We have the state has been now 4 divisions: orange, green, and red. And in orange itself, there is A and B. And now only in 7 districts, only in 7 districts, there is a certain level of relaxation. That doesn't mean that people can do as they like. There are stringent restrictions in many, many areas of activity. All the theaters are shut down. All the malls are shut down. And all the temples and mosques, the places of worship are also will be closed. And there's a small relaxation.
No, I understand that, Mr. Binoy Viswam. Yes. There is no denying the fact that the Kerala government has done a great job from having few cases, bringing that under control, to suddenly having a large number of cases again in round 2, and then still managing to flatten the curve the way the state government has, in the last couple of weeks. But I want to talk about the way forward from here, not what's been done, because that, I agree with you, a good job has been done. But I'm just going to read out from the letter that the Home Ministry has written to the Kerala government, which says, it is observed that the government of Kerala has allowed opening of activities which are prohibited in the aforesaid order. Such additional activities allowed by government of Kerala, including opening of local workshops, barber shops, restaurants, bookstores, MSMEs in municipal limits, bus travel in cities, towns for shorter distances, 2 passengers in the back seat of four-wheeler, pillion riding on scooters. This amounts to dilution of the guidelines. Now, some of it has been rolled back by the Kerala government, but I want to know your view. Wasn't it too soon to bring in these kind of relaxation?
Not at all. And when I say not at all, we would repeat what the Chief Minister told to the people today in the evening at 6 o'clock, that we are not in a mood of confrontation with the government of India. We will cooperate with the government of India, and only in constant contact and discussion with the government of India, we will go forward. We are not in a position to say that Kerala is a separate place where everything is safe. We don't have such a feeling. There is not even iota of complacency in the people of Kerala, in the government of Kerala. We believe in the people's sense of responsibility and the people's degree of understanding. And only with that understanding and cooperation, Kerala and the government could achieve what we have already achieved now. You see, the whole world is now looking to Kerala in praise. The world press also praises Kerala. They all say that Kerala has a remarkable fight, and in that fight, Kerala has a remarkable victory too. We should know that public health system in Kerala, it has shown the way to us. And the people's awareness, the level of literacy, the social consciousness, and above all, the involvement of the whole population, and the people and the government in unison. We fought the battle, and we continue the battle, and we will be very, very particular that no sense of relaxation will go to the masses so that they can come to the streets from tomorrow onwards and do as they like. There are restrictions, and from the experience of every day, every hour, we will tighten if there is a necessity. We are very serious, and we will see that normalcy will come only in due course, only in due course. But we want to tell the people that don't be in a panic. If people are united, if the scientific approach is implemented, it can bring success. That's our conviction.
Mr. Biswam, so you don't think that the government was moving a little too fast? Let me ask our other panelists also. Mr. Sudesh Verma is with us. Mr. Sudesh Verma, basis the data that Kerala has shown, the fact that they've managed to bring down the number of new cases, and the fact that any which way these decisions were not about the red zones but outside the red zones, would it have been a problem?
Tanvi, you see, we are very proud of Kerala, and Kerala has been always a matter of pride for us because it has the largest literacy, prosperous people, people who understand, educated people. So we are very happy that Kerala has been able to contain. But at the same time, there is no reason to veer on the verge of bravado, because you see, this is a disease, this is a virus, and one wrong step can scatter away all the gains which you have made. It is in that context that one must abide by the directive of the Home Ministry. That is a calibrated directive given after a lot of experience. We are getting inputs, the government is getting input, Prime Minister is getting advices what to do, and is thinking about the entire country. It's just sort of requesting Kerala to go with the national consensus rather than trying to go fast, because if you go fast, maybe you would suffer, and we don't want that to happen. And that is in that context it should be seen. And all the states and the central government are acting in unison. We are happy that the Delhi government has understood and acted accordingly. Other governments also, you see, we have been in lockdown for such a long time, and it's just a matter of 12, 13 more days. After that, a new strategy would be evolved. We'll have to wait for that. And already lockdown has been diluted as per the directive. Essential services have been opened, but there is no reason to open those places where people come in crowd, and you are not aware of the source from where the virus can come. You are not sure about anything. The entire nation has to work together. It is in that context that whether it's Maharashtra or it is Kerala or any other state who's thinking, yeah, we can understand Maharashtra being financial capital would be desperate to open. We understand that also, but at the same time, lives cannot be endangered, and every chief minister who think that what he is doing, it is going to impact lives, and people are not going to sit silent. So we must go in a calibrated way. We must be very, very patient. This is what we have been doing. You see the way people are violating lockdown. This is not in the interest of the nation. It's not that people in Delhi would suffer and people in Mumbai would not suffer, because the moment you open everything, again the things will start happening. So let's wait. There is no testing which can show you in 24 hours whether you have the virus or not. You have to wait for 5 to 7 days. So we must understand that is a very serious case, and it can endanger anybody.
No, I agree with you, Mr. Sudesh Sharma, when you talk about a larger movement across the country. But let's first focus on Kerala and what's happened there, because Centre picked it up and made it a big issue. I'm just trying to understand from both sides what were the factors that were, came into play. The Kerala government decided to bring in some relief in orange zone and green zones, which is what was said. Was that right or not, or are some of the states moving too quickly? That's what I'm asking you about. Let's begin with Kerala. Pillion riders, restaurants, bookstores, barber shops, for these to be opened, is it too soon for Kerala?
Yeah, we feel so, because you see, restaurants and such places where people come in large number, they gather together. You cannot make them sit at a distance which is required. And the whole norm of social distancing would be actually endangered. And there is no hurry. We have to be cautious. This is what we are saying. There is nothing against Kerala government. We all have to work together. There is nothing at all, and we appreciate that. It's just a matter of a few weeks that you could probably not do this, because health of the people finally is prerogative of all of us who are in policy makings, who are involved in the task of taking care of them. That all should come out of this virus, and all precautions must be taken. It's just for precaution's sake. There is nothing against Kerala for that matter.
Mr. Binoy Viswam, do you want to respond to that before I go across to our other panelists and bringing our medical experts as well?
Of course. I think there is a bit of confusion. That confusion is like this. Don't think that all the hotels, restaurants will be opened in Kerala from tomorrow onwards. No. From the hotels, they can do the home delivery only. Now people can enter a hotel as usual, sit there in a crowds, and have their food at the hotel. They can only order the foods, and the food will be delivered at their homes from the hotels. Should be clarified. Same with the barber shops. Same with the bookshops. Barber shops also only 1 or 2 days in a week in rotation. Bookstores also only 2 days in a week. That also in a regulated manner. Shops also will be opened, but that too in strict regulation. I speak on behalf of a state which could purposely and consciously and effectively could implement the lockdown. Maybe the only state who took serious steps to see that the coronavirus is defeated.
Okay.
And with that
yes.
seriousness, we approach the relaxation also. So please understand that we are not in a mood of confrontation. We are not. We are part of India, and we are proud to say that we are part of India, and we will be in constant contact and consultation with the government of India. One more sentence I would like to add. as a Communist Party member of Parliament. My point is that the central government, the same Home Affairs Ministry, has issued a statement to relax the work atmosphere for the migrant laborers without giving them proper, without ensuring their security, without ensuring their proper passage. The government is asking them, you go and work for the big builders, because the government want to protect the builders, protect the workers first, make sure that their life is secure, give them proper medicines, give them proper treatments, give them proper shelter. Without giving all those things, you are telling those people who are now under poverty, from tomorrow onwards, you can go to the workplace of big contractors and builders. And this is an approach of which the whole country, the whole trade union movement, the whole working class is a bit afraid of. We request the government of India, first you ensure the workforce and their safety. Then only you think of the big builders and their wealth and their property. The real wealth earners, the real wealth builders, the real wealth creators are not rich people, but the poor of the country. Please take care for them.
Okay, Mr. Binoy Viswam, let me just bring in another larger point that I want to talk about right now, and which is about the various change in rules that's happening across the states. Let me see if I can go across to Dr. Salunke. We've had a bit of a tech problem with his connection, but Dr. Salunke, let's take another example. Let's take the example of Mumbai. The Mumbai now, as we speak, has reported in all 3,000 cases just in the city of Mumbai. We are seeing on a daily basis 150 cases getting added to that. Can a city like Mumbai afford any kind of relaxation? Can a city like Mumbai say, okay, let's start with public projects, filling up of potholes, laying off pipes, construction work? Should this be allowed in such a scenario?
Definitely not at this juncture in city of Mumbai, which has a very peculiar situation, both epidemiologically and socio-economically. I do not think, as an epidemiologist and public health person, I will recommend to government to relax any of the present restrictions, not only in a couple of days, but at least not up to 3rd May, and that too after we monitor the daily occurrence of new cases. More than Mumbai now, I'm worried about our own country, including Kerala. The kind of cases that we are getting asymptomatic, and these asymptomatic percentage, which as ICMR today indicated, which we were expecting in the range of 30 to 40%, is now being indicated as around 60 to 70%. That's very, very worrying situation. Now, if 70% people are going to carry virus without showing any signs and symptoms, containment is going to be really, really a challenge. And let me assure you through this channel that we are here for long haul. Do not expect this epidemic or outbreak to win away in next few weeks. It will continue for at least few months. I appreciate the concern for our poor brothers and sisters, and we will have to balance it out. And that is the reason when I met some of the senior politicians in my state, I said, sir, I do not envy your position at all. On one side, people like us will like to insist on continuing containment and curtailment for as much more as possible. But on the other hand, we cannot be insensitive to the needs of not only poor people, but even for middle class. I know what we are going through because my family is also going through. But this is the really trying period for the entire country, or for that matter, globally. So I think we will have to think from a larger perspective. And even though health is a state subject, we will have to respect the national protocols and national guidelines, and how to balance it with ensuring that poor do not suffer more. Everyone is suffering and poor are suffering more. but we will have to find the balance,
Correct.
which is the challenge. Thank you.
Well, let me ask Raghav Chadha if he wants to weigh in on this. How do you maintain this balance then, Raghav? Because at this point, the Delhi government has obviously chosen health and public safety above the socio-economic impact, and where people are struggling because of that. How do you ensure this balance at some point?
First of all, every state has a completely different situation, and Kerala, for that matter, has been at the forefront of this fight, and they've adopted some really nice and effective measures to deal with COVID-19. And some of their measures have, in fact, even been adopted by various other states across the country. Now, Delhi, as I explained in my earlier argument, in my at the outset, that has a peculiar situation simply because of being an area where a lot of foreign travelers visit, and the headquarters of the Markaz was also in Delhi, and the community transmission in Delhi seems to have kicked in, and therefore the situation in Delhi may not be comparable to other states. I simply can't comment on Kerala because I'm not following Kerala as closely as I am and involved in the governance of Delhi as So I think the Chief Minister of Kerala, of course, who's the commander in chief in Kerala, as far as this war against COVID-19 is concerned, is best equipped to decide as to what is to be done. And of course, when these decisions are taken, the union government is taken into confidence, and suggestions from the union government are certainly given its a due credit. And therefore, I hope whatever decision ultimately is implemented in the state of Kerala will be done with close coordination and understanding and comfort of both the governments, whether it's the Kerala government or the Union of India. Now, having said that, yes, socio-economic parameters and concerns are concerns which may not supersede the concern of the well-being and healthcare of the people of Delhi. I mean, we are of the view that jaan hai to jahan hai. I mean, it's only when you have if you're able to save lives, if you're able to curtail this outbreak, it's only in that event that we'll be alive to even talk about the state of the economy and the socio-economic impact of COVID-19. So therefore, I think saving lives is of paramount importance, and that is what the government of Delhi is concentrating on. We're looking at multiple treatments. In the absence of a vaccine, the only thing one can do is look at various treatments, whether it's plasma therapy, whether it's looking at medicines like hydrochloroquine or remdesivir. I mean, all these things are being looked at by the government of Delhi, and hopefully we'll be able to flatten the curve as far as our NCT of Delhi is concerned, with the cooperation of the people of Delhi. And this is a war, this is a fight in which no state government or no agency of the state can fight alone. I mean, this is if anyone believes that the state alone can fight this, then that person is living in fool's paradise. I mean, utmost cooperation and sincerity from the people is required, because it's the community that can stop community transmission and nobody else. And I think what one is also seeing these days is either a state of panic or a state of denial. The state of panic is a state where people are, panicking about the outbreak and are very nervous. On the other hand, you have people who are in a state of denial, who feel that this disease will not do any harm to them, and the whole world can get infected but them. I think between the state of panic and the state of denial, there is a state of preparedness, and that is the state of preparedness. That is the state where I think all of us should find ourselves, whether it's our state government or the state government of Kerala or any other state government or the Union of India, for that matter. I think state of preparedness is something all of us should concentrate on and ensure that the chain is broken and the curve is flattened.
Okay, very quickly before I let you go, Raghav, because you've raised and your government has raised the issue of asymptomatic patients, and you touched upon it when you said that you have a very comprehensive testing strategy and contact tracing strategy. But is there also a need to spread about more awareness amongst people? You just said that there are still two different kinds of people. There are still lots of interactions that are going on within offices, within societies and neighborhoods, where people are still interacting with each other, and if 80% are asymptomatic, then that's a big problem.
Right. So I think it is essentially on these lines that the government of Delhi decided that no relaxation whatsoever will be given, and the entire situation will be reviewed again on the 27th of April to see whether any relaxation is required for the city of Delhi or not. At this point in time, the status quo is there, and the status quo shall be maintained. The law enforcement agencies, whether it's the government of Delhi, the Delhi police, the district magistrates, the SDMs, the ADMs are working very hard, working tirelessly, in fact, to ensure that every rule and guideline issued qua this lockdown is adhered to, and everybody follows that. I think all our legislators, including myself, I am an MLA of Rajendra Nagar Vidhan Sabha, I am also ensuring in my own way that nobody violates the protocols that have been set in place. And I think at the end of the day, as I said, I mean, the society as well as every agency of the government needs to work together hand in hand. I mean, if the people on one fine day decide that they will not comply with this lockdown, as you saw in the US, in the US there were protests in various corners of the country where people came out and said, we will not follow this lockdown. I mean, at the end of the day, we wish to step out of our houses and live a normal life. I mean, if the people do decide to not follow this lockdown, I don't think there's any state in the country that has the paraphernalia to forcefully implement a lockdown of this magnitude and scale. And therefore, I think it's important that we take our people into confidence. And therefore, you see, as far as Delhi is concerned, the chief minister every evening comes before the people, gives them an update, a real-time update of where we stand. I mean, he speaks straight from his heart. He doesn't mince his words. He is as honest and upright in his
Right.
factual sort of interaction that he has with the people of Delhi. And therefore, I think by virtue of that, we have managed to, bring in some awareness, some significant amount of awareness among the masses as to, the gravity of the situation and
Yeah.
the fatal impact of a epidemic like this.
Yes, and in fact, this is the point where I wanted a reaction from our other political representatives as well, Mr. Sudesh Sharma. In the light of the fact that 80% of the patients so far of coronavirus were asymptomatic, either had very mild symptoms or had no symptoms for most of it, and almost each state is showing that kind of a data. Do we need to be slightly more careful about the relaxations that we are bringing in?
Otherwise, you see, as Raghav was saying, you should learn from United States, the country that boasts of having all kinds of infrastructure, the most powerful nation economically. They are suffering. More than 35,000 people have died there because this coronavirus is not going to listen to you. If you allow the workers in Mumbai to work in construction, do you have enough care you can take if they fall ill because of COVID-19? Can you take care of them for 14 or 15 days when they would suffer? Do you have that kind of infrastructure? That is what you should decide when you go and open things, because you are exposing people to risk. Because you have no way, because of asymptomatic nature, that you can say that this person is suffering, this person is not suffering. You will come to know much later. So this testing kits, this PPE equipments, the hospitals, ICUs, do you have everything ready? Or you'd allow them to die if they suffer from COVID-19? This is a question that policy makers should understand before they hurry up in opening up.
No, but the point being that if I don't know around me who may be a corona carrier, then that's obviously a concern. If the signs are not showing and the symptoms are not showing, do we need to also make people slightly more aware that don't take your movements for granted, that you still have to be careful irrespective of whether the person standing next to you is showing any symptoms or not? Mr. Sudesh Sharma.
Yeah, this is what happened. You see, what happened in the market. The same thing, they never thought that corona could impact them. They went on doing their own business. So many people, yesterday I was seeing somewhere in Meerut, people are just walking in the street. So if these things keep on happening, people have to develop some sort of bravado that nothing is going to happen. If you don't take the lockdown seriously, if you don't understand the message which is being given time and again by everyone, every politician, every policy makers, every doctor, journalist, everybody is saying, if you don't listen to that, then you are exposing yourself to grave danger, because there is no equipment that can test and say immediately that whether you have the coronavirus or not. It will take time. It will take time for the virus to emerge and say whether you are suffering from it. So, can we take care of that? That is the whole point when you go and open up. That is why Home Ministry has come out with certain directives so that we go in a gradual, phased manner, so that we can control also if things go wrong. And that is the whole point about going about fighting this COVID-19 strategy.
Let me see if I can go across to Dr. Sudarshan Balal. Dr. Sudarshan Balal, as we now discover that more patients that have tested positive for coronavirus were actually not showing any symptoms, does that force us to relook at our plan for a graded relaxation of any kind?
It's always a very fine line that one has to walk between continuing the lockdown and breaking the chain of corona versus the hardship of the people because of the lockdown. But certainly, I think the lockdown has been very effective. And as I said, region wise, depending on the number of cases that happen, doubling time, so on and so forth, we should have a phased removal of the lockdown, not a sudden removal of the lockdown. And in spite of the lockdown being slowly removed, we should continue to maintain physical, social distancing, cough etiquette, cleanliness, and certainly the essential services, the agri sector, and to a large extent the daily wages should be the ones who should be relieved of the significant hardships that they're undergoing. And there's a very big difference between what's happening in the Western world and India. In the Western world, the healthcare systems are overwhelmed taking care of COVID patients. Whereas here, the patients who are affected are not the COVID patients because we have enough backup and enough numbers of beds in the hospitals to take care of the COVID patients, but a large number of patients who do not have COVID but still need care are unable to come to the hospitals. As you probably are aware, the occupancy rates in many hospitals are less than 30 to 35% of what it was. And at least in the southern states, the government facilities are also not overcrowded like what you see people being ventilated in the corridors of the footpaths in Italy, Spain, and even in the US. So I think the lockdown has been effective. The lockdown should be removed in a very phased manner. And it doesn't mean that once we remove the lockdown, we don't relook at bringing it in like what Singapore did.
Yes, in fact, we will have to constantly keep looking at it, basis the number of cases that begin to emerge from different areas. Dr. Balal, very quickly before I go to Dr. Salunke, let's just take the example of Karnataka to understand what you're saying and how, the state of Karnataka should look at this graded lockdown relaxation then.
Thanks to the Honorable CM, the government of Karnataka, and also, of course, the public of Karnataka, we have done a pretty good job. I think we have seen very few cases as compared to the average elsewhere, and hardly any deaths. Even one death is considered very, very significant. But if you consider the population of Karnataka of more than 65 million, the number of deaths are very, very small. And certainly the hospitals have a large capacity that is unutilized. For instance, we at the Manipal Group have dedicated a hospital to COVID with 150 beds. And believe it or not, we only have one patient in the district of Udupi right now in that hospital, which is a good sign. We are happy that beds are unutilized. But we also have to worry about the patients who do not have COVID and still require care, and we cannot ignore them. But when we do open the lockdown, please keep a close eye on the situation. And any signs of escalation of the COVID disease or the COVID virus, we may have to bring back some measures to slow down the virus again.
Yes, I just want to go across to Dr. Salunke and speak a little bit more about this point that Dr. Balal was making, Dr. Salunke. Perhaps we still don't understand that it's not just about a lockdown till May 3rd. That for now, many weeks and months, our lives are going to change because one, there is a silent spreader out there. Many of the cases are asymptomatic. Two, we still don't have a cure for coronavirus, and so it can always come back.
Hello.
Yes, Dr.
Hello.
Salunke, can you hear us?
Yeah, now I can hear you. Hello.
Okay, great. Dr. Salunke, I wanted to again ask you to emphasize on the point that irrespective of whether the lockdown ends on 3rd or maybe 2 weeks after that or whenever, that we are in this for a long haul. The fact that there are silent spreaders, the fact that there are asymptomatic patients, some who are not showing signs, the fact that we still don't have a cure, and so it can be easily transmitted, means that perhaps we need to follow these norms for a longer period of time, and life doesn't go back to normal anytime soon.
Absolutely, I agree with you. And as a matter of fact, every state. Am I audible to you? Hello.
Yes, you are perfectly fine.
Yeah.
Go ahead, please.
No, every state that has to now start working on this. That after 3rd, how do you relax these restrictions, but at the same time, how do we prevent the transmission? And that is the reason we will have to continue to insist upon following the basic public health measures, use of masks, and reporting of the cases. Like in Maharashtra, very wisely, Maharashtra government has given instructions through FDA that over-the-counter prescription of some of the drugs, like, which are normally used for cold and cough, need not be made accessible, but only through prescription. So earliest diagnosis or earliest referral will save a lot of lives. So after this lockdown is over, new norms and new strategies will have to bring out based upon the existing advice of using public health measures, social distancing, within the feasibility of what activity should continue, but at the same time, basic precautions need to continue. And this should become a part of our daily life. As I was telling someone, as we use clothes, as far as the Indian or even global population is concerned, use of masks will become now a norm without which nobody should be allowed to move, irrespective of what you do. Please use masks, and that should become now a way of life. So these are the kinds of changes in our social behavior will have to be incorporated. Whatever we have already stated about the distancing part, the hand washing part, this will have to continue now, I will say, even forever. Why only for few weeks or few months?
Yes.
It should become a part of our daily life. As we brush our teeth, on the same line, use mask, wash your hands frequently, keep distance from each other, do not shake hands. All these issues will now have to go forever. Our lives are going to change. We will not be what we were prior to this episode. So we have to now start feeling that there will be few restrictions, and those restrictions should become part of our life, and we should inculcate them rather than government forcing them or anybody else forcing them. Let us follow so that we will have minimal number of cases. Some cases are going to come, irrespective which state,
Right.
which area,
Right.
which cities, if they are going to come, there will be additional mortality, and there will be readiness. We will have to keep our health infrastructure ready, because also let us remember, this is going to come in waves. Even if there is a decline in X place or Y city or whatever state, that doesn't guarantee that it will remain like that. It is going to come in waves, and if we are not prepared, we will be caught unaware. So lowering of our guard
Yes.
will be a disastrous step, irrespective what achievements we have.
Okay.
Let's not, yeah. So let us be prepared now forever.
Let us be prepared forever. I would agree with you as far as some of these habits, hygienic habits are concerned, including washing hands regularly. We should have always had them, but yes, perhaps now more and more people will follow that. I'm going to thank all of our panelists for joining us right now. We watch out how various states now deal with a graded relaxation plan. We will watch out for how it works out in Kerala. Kerala has managed to reduce the number of patients, has managed the crisis very well in the first few weeks. Now, as they bring in some relief in few zones, all eyes will be on how they still contain the infection, and if there are any repercussions of this relaxation. One hopes not. We also will watch out for what happens in Maharashtra, in cities like Mumbai, where at least the civic body has decided to resume some amount of work. In cities like Delhi, where there is absolutely not going to be any amount of relief that happens. Here is why it's extremely important to not let our guard down. Look at the way the cases are still increasing in our country. Let's just look at April now. I'm not even going to talk about March, when we were still discovering, the impact of coronavirus isn't just to a few countries beyond China, but it is actually on all of us. But look at April. On 1st of April, India had 1,834 cases in all on 1st of April. Today, 20 days later, we have over 17,000 cases. So from about 1,800 to 17,000 in just about 20 days. Even if you just go 5 days back, on 15th of April, we had less than 12,000 cases. See how it's increasing. While yes, our recovery rate is improving, and more people are also recovering and getting discharged from hospitals, we are also detecting more cases. So we cannot let our guard down. 80% of the cases found so far did not show any symptoms or showed mild symptoms. So we cannot let our guard down right now, because we don't know whether the person standing next to us has any infection or not. It may not necessarily be showing at that point of time. And you know what? We also need to keep it in mind that we need to get rid of the stigma, because with the stigma comes the lies, comes the hiding and suppression of facts. And if we don't know how many cases are out there, we will never be able to defeat coronavirus. Suffice to say, viewers, even if this lockdown helps us flatten the curve and significantly reduce the number of cases, our lives for 2020 have significantly changed and are not going back to normal the way it was in 2019. Social distancing is here to stay for a while. Let's accept that and properly implement it. Thank you for joining us on this conversation. Relief and a relaxed, lockdown program. The state of Telangana, in fact, has decided to extend the lockdown all the way till May 7th. So there's going to be no relief at all as far as the state of Telangana is concerned, not just till May 3rd, but till May 7th. Paul has actually got us this report from Hyderabad to show us how the city is still following the lockdown extremely strictly, lots of barricading and security measures in place. Take a look.
While states across the country are thinking about relaxations from today, in the state of Telangana, CM KCR has said we will not be having any relaxations. We have a total of 858 cases in the state, out of which several areas are containment zones. And GHMC, that is Greater Hyderabad Municipal Corporation limits, have reported the highest numbers. I'm here at Kairadabad Circle. If I can quickly show you around. On the right side, this is the road that leads towards Hussain Sagar Lake, popularly called as Tangband. All such popular areas have been barricaded, not allowing anyone to move around. If you can see around the circle, it has 4 major crossroads, and here you can see vehicles moving around. These are all part of essential services, bank services, or have permission to head out. That is why you see a poster being put up on the cars as and when they move by. And if you can see on this side, all of these shops continue to remain closed. CM KCR has said food aggregators also will not be allowed. It will be banned from today onwards. And the most important point is that they have extended the lockdown until May 7th. If you take a look on this side, you can see a police checkpoint. Several such checkpoints have been put up across. People are stopped. They're asked for documents to prove why they're outside, and only then they are asked to proceed. In case of any violations, their vehicles have seized. 50,000 vehicles have been seized over the last couple of days. All these are vehicles of people who have actually violated the lockdown. CM KCR has said domestic airlines will not be allowed to fly into Hyderabad or Telangana, in fact, until the 7th of May. So despite the lockdown, national lockdown being lifted a couple of days earlier, Telangana will not allow flights to come in until the 7th of May. On the 5th, there will be a crucial cabinet meeting that will be held, after which a decision will be taken based on the circumstances. As of now, on an average, we are seeing around 30 to 50 cases turn positive in the state of Telangana, a total of 858 cases. The state administration, health department, frontline warriors doing all that they can to ensure that they fight this deadly virus.
Now, as we saw more easy movement, especially of essential goods and all kinds of goods, there was quite a bit of activity on the DND flyover and at the DND toll, which connects Noida to the national capital. Only vehicles that had obtained passes and were part of essential services were allowed to pass through. And here's a report that Siddhant got for us.
Despite the MHA guidelines, the district authority in Gautam Buddha Nagar and Delhi government has decided not to give relaxation to the citizens. Now, despite that, at the DND flyover where I am reporting from, in the morning we can see heavy traffic and the cars lined right outside the DND toll plaza where I am reporting from. Now these cars, the time they reach DND plaza, the cops is standing here, ask for either curfew pass or you have to be in essential services, doctor, government employees. Only those vehicles are being allowed by the cops standing at DND plaza. Now today is the 20th April. NHAI had also ordered to collect tolls at various toll plazas, and at the same time across the country several districts have been given relaxation, several state governments have given relaxation, but as far as the Gautam Buddha Nagar district is concerned, other than containment zone, very few relaxations have been given to the citizens. At the same time, if we talk about the Delhi government has decided to assess the entire situation on 27th of April and then take any decision after the revised MHA guideline. So far in Gautam Buddha Nagar and National Capital, the status remains the same. But despite that, at the DND flyover, at the DND toll plaza, we can see the cars lined up outside the toll plaza. We've also been told by the cops that most of them are the doctors, medical staff, government employees, and those who possess curfew passes. With video journalist Parvez, Siddhant Mishra in Gautam Buddha Nagar for Times Now.
With that, it's a wrap on this edition of Urban Debate. Thank you for joining us.